This is certainly a difficult time for our country and our world. And here in New York, we all hoped that the rest of the country and the world wouldn't have to face the same surge of sick patients with COVID-19 that we saw overwhelming every single hospital in the city and the region. But that's not the case at all in the U.S. And in countries around the globe. You all know well that the hospitals are struggling to care for very ill, incredibly ill patients. With Doctors Without Borders, I'd worked in measles and cholera epidemics, and I'd worked in Liberia throughout the worst part of the Ebola crisis. But I still wasn't expecting, and I wasn't really prepared fully for the difficult situation and the conditions when COVID infections really were raging here in New York. In my hospital, I could tell you it was absolutely an unrelenting situation with tens of thousands of frightened patients pushing into every space that we had in our facilities in the first week of the crisis. Many who came seeking care had early symptoms. They had mild symptoms and they wanted a COVID test or they wanted reassurance. But we had no real treatment for them. Hundreds of patients sat outside the perimeter of our emergency department, and then hundreds more filled into overflowed areas of the emergency room itself, waiting to be admitted to one of 18 completely new inpatient teams that had been created just to care for COVID patients. And COVID-19 was really something that I felt, and my colleagues did too, that was completely new. None of us at all, absolutely. We didn't expect the dizzying array of protocols that were constantly changing to guide us in our therapy, sometimes changes that took place several times a day to try and treat the effects of the virus on the body's clotting system, on the heart, on the kidneys, on the immune system, and more. And for sure, we had read about what was happening in China and in Europe, and we thought we were prepared for what was going to happen, but I don't think we were prepared in the ways that we entirely should have. I don't think we expected the sheer volume and the crush of ill patients that came. We didn't expect to see the deterioration, the very rapid deterioration of patients. Find patients sitting up in bed, eating breakfast, doing fine, only to be called to the very same patient only a few hours later to find them in severe respiratory distress, all with little or no warning. We didn't expect, we weren't prepared to be running low on personal protective gear. And we didn't expect that we'd have to reuse single-use gowns and masks. We didn't expect, and we couldn't anticipate how difficult it would be to work in full personal protective equipment, and we weren't really prepared for how patients would react to the inability to see us and how difficult it would be to talk to them when we were wearing several masks and a face shield all at the same time. And we struggled to, as no family members were allowed into any part of the hospital, from the emergency room to the floor of the hospital, and we were forced to have really, I think, wrenching discussions with family members of dying patients, and we had these by phone or by video chat. Entirely inadequate. It was all we had. We did the best we could, but none of us were really prepared for that. And I tell you all this because it's what it was like in our city, in our hospitals, taking care of patients. We managed to find hospital beds. We managed to find oxygen, high flow oxygen, and ventilators. And we managed to get last minute donations of protective equipment when it seemed that we were going to run out. We marshaled the resources, consolidated what we had, and then things eventually stabilized and improved. But New York, not usually thought of as a low resource setting, in many moments really felt like one because of the way I think we prepared or didn't prepare properly. But I tell you all this also because I know and I'm deeply concerned that African health systems which are true low resource settings, don't have the capacity to respond on this scale. There are superbly trained physicians and nurses in Africa, that's clear, but faced with the sheer scale and the pace of infections in communities that we saw and the need for hospitalizations, I don't see that there is really any way that systems could cope and very soon would reach a critical tipping point.